Hi, I'll be I'll be talking about checking on post-operative patients. So the first thing that will be done while the patient is in surgery is that the recovery room is going to be prepared. The recovery room is going to be equipped with the right machines for checking their vital signs. The beds and blankets are going to be prepared. They're going to be warmed. The pillows, the supplementary oxygen, the IV tubes, and the likes. And then after that, they're going to decide on the transfer route of the patient from the surgery room and onto the recovery bed. So the nurse and the nursing assistant are responsible for deciding which transfer route is the most appropriate depending on the patient's condition. And then after that, after the patient is transferred onto the recovery bed, the patient is going to be assessed for their condition by the nurse, and also the vital signs are going to be checked by the nursing assistant or by the nurse. And then the next thing would be to prevent complications. We can have respiratory complications, circulatory complications, and infections. So for the respiratory complications, depending if the patient is conscious or unconscious, for a conscious patient, they can be asked to do a few breathing exercises if they can't breathe properly, or if they're coughing, or if they're having difficulty in breathing. If the patient is unconscious, they'll be positioned in a certain way that will relieve the stress on the lungs, or maybe they can be given supplementary oxygen. And then for the circulatory problems, the patient can be given anti-clotting medication, or they can have stockings that are put on their legs to reduce the chances of thrombosis and blood clots forming on the patient's body. And then for infection complications, the patient's surgical wound will be cleaned regularly with precaution. And then after that, it will be decided on the type of nutrition that the patient is going to get, the route in which they're going to receive the nutrition, the type of elimination method that they'll be given, and also the positioning that the patient will be in throughout the recovery. The patient will also be assisted with ambulation. They'll be also assisted with the hygiene throughout the post-operative period, and also the condition and if they're recovering well will be noted throughout the whole post-surgery time period. So basically it will be positioning of the patient, nutrition of the patient, elimination method, ambulation of the patient, and keeping hygiene of the patient, and checking the vital signs of the patients from day to day. Thank you.